Welcome to Airway Answers, expanding your breadth of knowledge. My name is Nicole Goldfarb, and I'm a speech-language pathologist and certified orofacial myologist, and I'm here to help you find your airway answers. We're in this together. Let's do this. Hello, everybody, and welcome to Airway Answers. Today, I have Dr. Maria Sokolina here with us, and I'm just so delighted to have you on my podcast today, Dr. Sokolina. Thank you for joining me.
I'm so honored, and I'm going to talk about specific reason why I'm so honored, and it's more than one.
Oh my goodness. Well, we started chatting right before I hit record, and then I'm like, stop, don't talk, because I want everybody to hear all of this. We have very similar vibes and values, and so this is great. So we're going to talk about that, but I want to introduce you first so everybody can hear your amazing background, and then we'll get chatting. Dr. Sokolina is the founder and CEO of Harmony Dental Arts, and you are dedicated in the field of sleep and airway to creating a healthier world by promoting healthier, better breathing, which leads to better sleep quality. Originally from Russia, Dr. Sokolina graduated from medical school with a dental degree before earning her DDS from the New York University College of Dentistry. With expertise in dental implants, cosmetic dentistry, full mouth rehabilitation, and orthodontics, she is also deeply involved in dental sleep medicine, focusing on innovative solutions for sleep apnea through dental appliances and myofunctional therapy. Wonderful. We're going to talk about that and how you work to combine those efforts. Dr. Sokolina is the author of a new book, and we're definitely going to talk about this. The title of your book is called Breathless Awakening, and it's a medical mystery interwoven with family drama and love, shining light on the hidden epidemic of sleep-disordered breathing. This sounds really great, so we're going to go over that. Dr. Sokolina practices in both Manhattan, New York, and Clifton, New Jersey, where she helps patients restore health, function, and confidence. Previously, she has served on the boards of the American Academy of Dental Sleep Medicine and TEDx. A sought-after speaker and educator, her highlights and insights have appeared in Forbes, AARP, and Sleep Review, among other outlets. Beyond dentistry, Dr. Sokolina is a supporter of the arts and theater, believing in the power of creativity to heal, inspire, and connect communities. And that probably is part of your motivation for writing a book, using your creativity, and a really interesting sounding book as well. You also have a Facebook group called Sleep Apnea Help, and you also have your own YouTube channel interviewing other people, and you're going to be interviewing me as well. So this is great. You bring together experts. We love this. Getting these experts together to grow awareness, resilience, and hope. And it's just an honor to have you and to connect with you. So thank you again for being here.
Thank you, Nicole. And I would say we had a long journey towards each other. And I'm so happy to be here and being on that podcast. And I think you're doing amazing thing.
Thank you. We have the same mission. And these interviews, these podcasts that we do, it's volunteering our time and energy. But the interesting thing is, to me, and I'm sure to you as well, it's actually inspiring. It's motivating. It is work to get the questions together, coordinate the interviews, get all the background information, get this all set up. But once we're in the interview and we finish, I am energized. I don't know about you, but I'm like, woo, and it stays with me for a long time. So it's really such a great thing. And I want to talk about how you got involved in the field of dental sleep medicine, from being a dentist and then specializing in airway and dental sleep. Did you have an aha moment?
I don't know if it was aha moment or it was a lot of scary moments. And I always say I become involved in that field outside of fear. Like fear was this driving motivator to me. So my idea, what everything gonna be aesthetic, I'm gonna create such a beautiful smile, but people gonna smile for the rest of their lives. Okay, we're talking about dental decay, periodontal disease, but at least in a way I approached that. I did not find, except the root decay to be uncontrolled force. periodontal disease as well. You educate people. I don't do full mouth rehabilitation or smiles on everyone. I select specific people who can take care of my creations. But one force, what I was not able to control was bruxism. Was just all of a sudden, I did not eat anything. And now it's broken. It can be broken horizontally or vertically. And like, what do you do? And even before I did it, like I saw the teeth and dentin showing. I look in the mouth all the time and I see, yes, people need my help. They're very sensitive. They don't look great. They look old. So I can do it. I took, of course, a lot of postgraduate courses to learn how to do that. And okay, I can offer them the night guard. True, that's true. But even to offer that, I find something wrong about this particular concept. I really want to find out why is that happening. You now I luckily know that, yes, and I came to dental sleep because I want to protect my work. That's the very clear answer why I become interested in that. But actually, originally, it happened on an orthodontic course with our colleague, and I always thank her for that, always mention Dr. Michelle Wedel. We were in the same residency program, and luckily for me, we met on an orthodontic postgraduate program. And I share my challenges and orthodontic relapses, broken teeth, and she said, oh, maybe you should take mini residency on sleep. It was so many years ago. It was totally different landscape. And I took that course with a friend, actually, who I tried to encourage to do the same thing like I do. And I was thinking, okay, that's sort of insurance for me. Sort of, because it doesn't mean what I want. Everybody gonna want the same thing. But yes, I can do my dentistry. And if I suspect sleep issues, I can approach it prior to starting the case and educate somebody and already do it that way. And of course, not everybody who I suspect have a sleep issues need oral restoration, full mouth rehabilitation. So I can help those people as well. And another reason, I do have troubles with my sleep as well. So being said, sleep was exciting to me for my personal reasons.
Yeah, it's funny, don't we all, right? Once we learn about this information, it's either we seem to learn about it from ourselves, a family member, a good friend, or our patients directly, where we're treating down sort of one avenue, being blinded to another causal factor of these issues. And that's very common. I see in restorative dentists who go into the sleep realm and the airway realm, is that those bruxism patients who maybe that dentist has not really investigated why is there bruxism to begin with, but the patient is actually destroying their teeth and then destroying the restorations. And I had patients, I always talk about this one lady, one of my patients who had like $80,000 in dental restorations until she was referred finally to myofunctional therapy, and the whole sleep bruxism underlying cause, the airway issue, was investigated. But she kept cracking, breaking her teeth and the restorations, and it's costly. And really, that's still just a symptom of a major health problem that's going on. So it's interesting how a lot of different specialists have found the airway realm the same way. It all comes together. And you mentioned night guards. So it was actually one of the questions I wanted to ask you maybe towards the end, but let's pop it in right now because I'm curious, what are your thoughts on night guards for patients who have bruxism?
This is a very great question. And my answer is going to be quite sophisticated on that. So besides sleep can be one of the reasons, because people have a tendency to do this wonderful activity during the day. And that was one of the puzzle through 2 decades of my dental career, why people grind. And yes, people talk about, I took a lot of courses on that. People talk about that from a lot of different streets and avenues. Yes, I'm a big proponent of myofunctional therapy. I believe in the function of the tongue. And I was so surprised what a lot of people cannot even connect to the tongue. They don't feel the tongue. Now I have referrals from ENT. A lot of times people come with the ear pain, maybe with some dizziness, tinnitus, but the different symptoms of this area, loss of balance, not so loss, having troubles with balance, and ENT refer for the guard. I really believe in the guards, and I do different designs of the guard, and I do TMJ treatment in conjunction with myofunctional therapy. But this is a wonderful discovery what made me connect all little pieces, what I do now, guards, with physical therapist and with behavioral optometrist. Because now when I realize what a lot of people really searching for balance, emotional and physical, which very often the same thing, I try to look through that lens. Okay, we're looking for balance. And to find that balance, we have to stand on 2 feet upright and hold our eyes on the level of the horizon. And this horizon keeps switching and changing, and that's how we tense our muscles. And a lot of it, we cannot really, it's not on a conscientious level. It's subconscious level. Our body does a lot of things without us realizing that. And when we realize it as a pain, certain type of pain and damage in the teeth. So I try to look through that lens. It's a very long game, but it really helps me to help the patient. And I understand not everybody need to take that long road, or maybe it's not the right time because we live through different periods. So when I have my view of understanding the problem and I can offer solution, temporary solution, more long-term solution, lifelong solutions, then I feel good and I designed it like that. So I don't know if I answer your questions on the guards, but I look through that perspective, and it's actually helped me to design orthodontic cases now, because I don't want to put patient in the guard forever. And it can be prosthetic cases or orthodontic cases. So I try to create a plan according to specific circumstances, looking at the guard.
Yeah. So that sounds like you're not just utilizing a night guard as here's a night guard, here's a band-aid, we're going to protect your teeth, but you're treating holistically the other components that you feel are involved in bruxism to help the body attain that balance so there's not that clenching or grinding behavior to achieve that regulation. We find a lot of dentists who are unaware of really even seeking the underlying cause for bruxism, just prescribe a night guard and that's it. Just thinking, let me protect the teeth, protect my work, protect your teeth. And you're addressing other components related to it. It's a little frustrating because when I go to my dentist, I always hear in the next operatory is over, he's like, oh, let's get you a night guard. Here's a night guard. And I'm like, I have to talk to him. So my appointments end up being really long because I'm really annoying patient who I'm like, you shouldn't just prescribe the night guard without realizing what's going on. In my training in myofunctional therapy from my mentor, she helped me learn that bruxism or any oral habit, even gum chewing, or for children, thumb sucking, pacifier use, nail biting in any age, any oral habit causes the body to release endorphins like serotonin and those regulating, calming chemicals that help put the body in balance, help regulate the body. So during the day, someone might clench or grind their teeth when their body's dysregulated, which could be when that person is hungry, angry, tired, bored, frustrated, in pain. These are some reasons. So they might clench or grind to release those chemicals to help bring them to baseline.
I
But
love
during
it.
the sleep, right, during nighttime, The bruxism is triggered by a sleep disturbance, any sleep disturbance, which could be factors like caffeine, having caffeine close to bed could trigger a sleep disturbance, eating a heavy meal, sounds in the room like the spouse getting up in the middle of the night to use the bathroom, or that person tossing and turning. Or we had a child who had a hamster in his room, and the hamster is the night animal, right? So running on the wheel of the cage, spinning around, making noise, the child's grinding his teeth. They get the hamster out of the room and the grinding stops. Any nighttime sleep disturbance. However, research shows that the majority of sleep bruxism, so sleep bruxism, that nighttime sleep disturbance is actually related to an airway issue. So when we address that in our patients, when it's sleep bruxism, we go over airway components, look at that factor, and we also look at any other daytime or any potential sleep disturbances as well. So that makes perfect sense that we don't just say, here's a night guard, let's protect your teeth, but we look at the underlying cause and treat that more holistically. And what I've learned from trainings is that the night guard can actually make the airway issue worse in about.
Yeah, there are some articles on that, of course. Some people said it's not such a clear studies. I usually bring that articles when I lecture. But good thing is I put in my story, in my book, I put a nighttime bruxism and wrong myofunctional habits and breathing disturbances. I put it in a story, what people in the shape of story can maybe recognize themselves or the loved ones.
Let's talk about your book. Okay, so your book that you wrote is coming out May 2026, called Breathless Awakening, which that sounds like a movie. Maybe it'll be a movie at one point.
I really hope it's going to be a Broadway show.
That's really neat. Using your creativity, that would be really neat to have some Broadway performance. So you describe it as a medical mystery, a family drama about sleep apnea with real experts inside. And many of them you've interviewed on your channel or know in the field. And it's about helping people with the treatment alternatives to CPAP, including myofunctional therapy. So your pre-launch is October 6th. Is that correct?
My pre-launch is starting October 6th. So for people
Okay.
who are interested in their journey and want to support the book, but actually I think going to help a lot of professionals to explain the topic and a lot of patients to understand the topic. I would be very happy to take them along on my journey. And by the way, you are in my book.
Ooh, I didn't know this.
Yeah.
Well, let's all go on this journey because this sounds really great. And when we write books and try to educate our patients, we have to make it interesting because a lot of the medical jargon and the acronyms can just be confusing and overwhelming. So I want to talk about your book and what is it about? What inspired you to write it? Why did you write this book now? How long has it taken you to write this book? Tell me everything.
Yeah, so I would say I'm a person who believes in serendipity. And sometimes it sounds very unscientific to say, but I'm a spiritual person. So I had two signs. And one of the signs was actually a loss. I lost one friend. And he snored very loud. And when it happened in age 47, for me, I still don't comprehend. Like I'm in my studio and I have a lot of art. It's not his art, but the art I have here in the room because of him. So I have reminders of him every single day, and I don't want him to be forgotten. He was not a dentist, but he was surrounded by dentists. And it was X amount of years ago. And yes, I did talk to him about that, but a lot of other people talked to him about that. It was okay. And just he fell asleep on Saturday, did not wake up on Sunday. So yes, he had untreated sleep apnea. Yes, I want to bring him in a book because I don't want him to be forgotten. It's my own vulnerability topic. He was not my husband, but he was somebody I really love. So that happened, one story. But then it was not enough for me to start writing my book. I had mandatory CPR training in my office. Just like any dentist, I have to have a training every 2 years. And happened to be that week after, my dental assistant got into the kitchen and found her husband breathless on the floor. And she used the knowledge and skills she got on CPR training. So it's not a joke, these trainings. They really can save lives. So she, with 911 on the phone, saved his life. And he was a husband of my dental assistant. So obviously, I saw his mouth. And in this specific case, I educated her and I educated him. So grinding and reflux signs. So all the classical sleep apnea triad, you name it, he had it. But he was not interested in any treatment. So when it happened, she found him breathless and she was able to breathe a life into him and saved his life. So now he has defibrillator for his heart because he had a ventricular fibrillation with a survival rate of 3%. So she is really brought him to life. And it luckily, what for my first friend, it happened during the night. He was not alone also, and they did the CPR, but nothing happened. But she did it for him. It happened early in the morning, but she was awake and she saved his life. And I have the interview on my channel about this particular story. So she, after that, he was much more accepting the treatment. So now he has oral appliance therapy and defibrillator. And I saw other cases, not as close to me or as dramatic in my practice. And I like to write. I write for Forbes, I write the articles. So I thought, okay, I have to put all this experience, what I get from people like you and from my patients and from a lot of people I interview on my channel into interesting time capsule to kind of describe this ecosystem we live in. Yes, it's true, a lot of people are tired, a lot of people is in that sympathetic mode, in that anxious state. A lot of people don't even know they have to breathe through the nose. A lot of people had a very specific orthodontic treatment with 4 bicuspid removed. A lot of people suffering from CPAP machine. Yes, I have an article on tips and tricks for CPAP because I work with a lot of sleep physicians and they share the good ideas. I put it in the article, I put that in the book, so it might help people. But most important, I find what we live in a very interesting ecosystem where the dentists or dental professionals or myofunctional therapists or speech and language pathologists, they live on one planet. And we on that planet are so good. We have a lot of success cases and we really help patients. And on that planet, a lot of osteopaths, craniosacral therapists, physical therapists, we all live happily on that planet. But there is another planet called sleep physicians. And it's a wonderful planet as well. They have a lot of wonderful therapies. And they trying to help patients that way. But it's very unfortunate for these two planets. They live in a different universe and they almost don't have any communications. At least that's how I see that. So I want to bring people from that planet, from the planet where the medical professionals live, including cardiologists who save my friend. In one case, in another case, it was too late. And they provide a lot of great things, but they don't know about our dental planet. They have no clue. They know there is a CPAP. They know there are a lot of people who don't want to use the CPAP, and there is Inspire and maybe orthodontic surgery kind of, but they're not so interested. Now they got this pill, GLP-1, which I write about that as well. I think it's a great tool. In addition to nutrition. So that part on the dental planet, we talk about that, but not that much, but a lot of allergy. So communication between these two worlds, that's what I want to happen after reading my story, because my story is about science, evolution, and love.
Sounds just fascinating. I know that you had said that the book follows real families and health journeys. So it's more like a storytelling instead of clinical insights. It's storytelling. Can you tell us more about how that is and how many different families you follow or patients? What is it like?
Yeah, it's a story of that family. And story of the family who start so difficult. But I don't want to reveal everything. But what I have to say, there are male, female, and a child in that story. And they all affected by, I would say, airway disorders in a different way. But what I want to bring up, it's not like a patient case. Sometimes we talk about this particular patient, and this patient has a tongue tie, and this patient has a malocclusion and a crowding and very narrow palate. But it's the person attached to that symptoms. That child who might have a very difficult time concentrating, and that child might have just a different growth spur or development. What we want everybody to be the same in the first grade, in the kindergarten, and we have a certain standard, but this child might be unique, and to see that uniqueness in a good way. And yes, it might be some troubles as simple as sleep, as simple as nutrition and allergies, and a lot of fights what we don't really look at. And sometimes they just piled up and become big, very ugly bunch of problem when somebody reach adulthood. And also, it's a patients who come to us, they have AHI of 30, oxygen nadir 77, and they have 3% of REM or lack of REM. So they are like numbers. But behind that, it's also human being who cannot really fulfill the dreams or even stay calm during the day, feel constantly irritated and in that depressed state, what he cannot really push himself to do something. Or like I wake up unrefreshed in the morning. Like behind that, that's the person who maybe dreamed of love at certain point of his life and physically cannot do that. It's very hard to look at that as well, because we are emotions. We are all emotions, and sometimes we don't think about physiology behind those numbers, or we might not even think about combining that. So I want to bring the human perspective. And also, there are caretakers, people who take care of these individuals, and they might get burned out on that route. So I want to bring topics what I care about deeply or seem so sharp to me in one book. When once people read it, they look at the husband who did not brought trash out, or like it did not help with the garbage, didn't help with the dishwashing, or didn't do some regular things, maybe a little bit different.
Wow. Yeah, that's a great way to explain it. And it sounds like it's helping to bring just a broader understanding for everyone involved. And it's true that, and I think it's important for people to know, it's not all about breathing and sleep. We all have genetic tendencies towards different disorders, diseases. But if you are not breathing well and you are not sleeping well, whatever your genetic tendency to is probably going to be more manifested, whether it's autism, whether it's depression, whatever is in your genes, it's more likely to come out when your body is just trying to function and not sleeping well, not breathing well. And there's so many different components to treat in our patients, whether it's the structural piece, whether it's lifestyle, nutrition, and then exactly what you're saying. Now, let's just pretend there's a child who's struggling in school with ADHD, learning disabilities. That child does not sleep well. And now that child's getting bad grades. They're getting in trouble at school. And so now we have emotional impacts on this child, and this forms the life of that person. And there's so many different pieces. We all need to be so aware in this whole picture of what's going on with our patients, because you can't just expand the palette and life is great, right?
It's never closed book. And
Right.
it's also very hard to accept for people like I invest. I spend so much time doing that, and it's still not good because it's not a closed book. You're still living, you're still breathing, you're still eating, and it might be lifelong exploration of yourself.
Exactly. And there's many non-anatomical factors to sleep quality. I interviewed Dr. Lamberg recently, and he just really went into great detail on those components as well. And our body, the whole autonomic nervous system, can be reset and thrown off when we have these issues from early childhood. And yes, you can correct the structural piece, but we also need to address the breathing, the emotional aspect, the social aspect. I like how you said the caregivers maybe taking care of that child with ADHD and hyperactivity and moodiness. I mean, that person gets burnt out. Exactly. And then we all react to each other. You didn't take out the trash. So, really, it sounds like your book is going to really help bring awareness and understanding and empathy towards all of us as just human beings.
I really hope so. I really hope so. And with your support of interviewing me, I really appreciate that. And if people want to participate in my book journey, I will provide the link underneath this interview, and they can be part of my email, like a closed circle where I share the news about this book development. This book is already written. The book is already exists. That publishing journey of what I'm going to do with the book, how I'm gonna bring the book to life, or maybe bring the book to Broadway show. So I have two different scenarios for the book.
That's awesome. This is so great. So we'll definitely have a link so people can follow that book. And do you have the website available?
I have a website. My website is Dr. Maria Sokolina, and I have a lot of practical help, I think, on that, but it has a link to the book, and they can see that, they can click it and get on my email list and subscribe, and then I will stay in touch with them and help them as much as I can.
Sounds so great. So delightful. And I want to know, you said maybe I was inspiring for something in the book, or maybe you can't reveal, I don't know, but let's talk about, if you want to talk a little bit about that, or just how we were talking about serendipity.
Yes.
And things happen for a reason. We both believe that. Things kind of come full circle. And I feel like everything we do, there's a reason. Every connection we make, whether we see it at the time or we never realize, or we see it in the future. And it's always good to let that person know, or let people know, wow, you inspired me to do this. I always try to reach out and let that person know. And many times I forget, but you just were at the Great Mewing event in London.
Yes.
And you thanked me for that connection. It's like, but I didn't do anything. So tell me what happened.
No, it's such a beautiful story. And I really want you to take credits for that, because from that story, it's going to be a lot of good things growing out of that story. So I follow your podcast really carefully, and I appreciate what you bring, all this knowledge. And I find the podcast in general, it's a new form of connection with a lot of people in the same mindset. So I saw Dr. Mew interview, and to tell you the truth, I was on another mewing event 2 years ago in New York. And I met Dr. Mike Mew, and I explained to him what I highly respect what he did. And he changed the way I practice dental sleep. I practice from the function, what we just talked about, that function and a form perspective. And I asked him to become a guest on my channel, Sleep Apnea, Breathing, Snoring, Health. And I don't know really why, but nothing happened. I try several times. It's not just one ask. I try and I communicate several times. Nothing happened. So on your podcast, I saw his interview, and I reach out again. And guess what? He said, oh, I remember we met. I really want to be on your channel. Let's have the interview. So we had the interview, and it was a wonderful interview, and I broadcasted, and it was before the mewing event. And I don't know really what happened, what type of magic happened on that interview, what the next step. He invited me to be a speaker. And it was a week before the event. But knowing myself, I really like Dr. Mew. I highly appreciate the work he did. I put myself together with the talk. I put together the talk for the mewing event, and I went and I present. And that's a wonderful thing to present in London or being in London. And I have a lot of friends in London. So it was great 3 days roller coaster of event. I visit John Mew Castle. It was a memorial. So that was very eventful from that point. But I met a lot of people who think just like us from around the world. And I become part of that dental facial development society. Now we're on a WhatsApp group and I'm learning about international perspective on the topic. It's not so different from us. It's wonderful people in Greece, people in Romania. Good ideas. I'm a big student of history. So I know how good ideas become household item. They have to happen in a lot of places with totally different people. So it's happening right now in front of our eyes. And chance for me to go on a mewing event and speak on a mewing event and met all these international people and connect with them, and they're going to be on my channel, so we be able to learn from them, was all because of you. If I wouldn't see Dr. Mew on that interview, I would never went ahead and reach out to him and get whole thing started. So you had that raindrop, what make this whole, I would say, glass full.
That's so sweet. The raindrop that made the ripple and spread everything. Well, that's so
Yes.
wonderful. And for Dr. Mew, the timing was right for him then to go on your podcast and reach out.
Yeah.
And things happen coincidentally, timing wise, and also our own effort to just keep being persistent and learning and what we want to get across and what we want to learn. And it's so wonderful. It sounds like you found your international Airway family that you didn't even know existed.
I didn't know exist. And it's interesting because some of the people who won that conference, like Patrick McKeown or Barry Raphael or Kevin Boyd or Bill Hanks, names what are so close to us because we learn from these people, I met on a conference as well. But in addition to that, there was other group of people who I didn't know even exist. And now I do, and now we're going to learn from them.
Yes, and you're going to spread that information when you interview them. So
Yes.
what was the presentation about at the mewing event?
On the mewing event, I talk about this topic, what I really want to bring to dental sleep medicine. What dental sleep medicine, just like any medicine at this present time, form and function, they have to coexist together in any type of therapy. If somebody break the hand, of course, you get in a cast, maybe surgery, but we don't talk about physical therapy. Everybody knows they need physical therapy. If somebody, God forbid, got a heart attack, after the heart attack, rehabilitation always include physical therapy. It's not a question. How come orthodontic treatment for 2 years in splint doesn't include it? How come orthodontic surgeries very often don't include it? How come dental sleep medicine, which is a therapy for so many years, don't include it? Like, I'm just wondering where we got this idea. We don't think we get physically fit if we just walk on the street. In the same time, here, because we eat or we talk and we use these muscles, we don't get physically fit. So my talk was about that conundrum. How come? And I was talking, of course, about how I do incorporate. Not everybody ready for myofunctional therapy course. Of course, people have to be ready. It has to be right time. But talking about basic, about nasal breathing. And I learned a great fact, but now make total sense to me. It's a very different effect when we breathe through the nose and we breathe through the mouth from the point of carbon dioxide. A lot of people, what I'm trying to convert from mouth breathers to nose breathers, they cannot withstand the amount of carbon dioxide they get through the nose. So we have to do it very incrementally during the day to be able for them to become a nose breather. I'm not talking about allergy or stuffy nose. I always talk about that with my patients to open the pathway too. So it's a simple things. And tongue, of course, space for the tongue or tongue function, important topic for dental sleep medicine, because I don't want to say everyone, but I think it's everyone have a very lazy tongue. Everyone who see me for oral appliance therapy. And very often ask them to move the tongue forward, to move it left, to move it right, to make a ball, to make a narrow tongue, to make a tongue on a spot. They don't know what I'm talking about. What type of language? Maybe I speak Russian for that moment.
Well, it sounds like, and you feel it's very important for dentists to be aware of orofacial myofunctional therapy, to be aware what it is, how function impacts form, shape, structure of the oral cavity, our breathing, and also our overall health. So, how should a dentist know when to refer out for orofacial myofunctional therapy?
I personally, how dentists should know that, I wouldn't be able to answer. But I feel what in dental school, just like in medical school, they should have an idea of what form follow function. That simple thing, what form follow function, and maybe to implement that idea into any course we take.
Agreed. That would be incredibly important for that knowledge and information to be standard in education, to be standard in our studies. So we're knowing the why behind all of the dysfunction, and it's really not part of it. I mean, there's so many dentists and orthodontists who don't even know what myofunctional therapy is. And then there's so many who refer for myofunctional therapy, but I don't think they might understand why. It's really weird, but I had this one case where it was an adult male who had palatal expansion and it relapsed, and the orthodontist then referred him for myofunctional therapy. The patient was very upset about the relapse of the palate narrowing again. And I don't know if it's going to be a lawsuit or is asking the orthodontist to pay for treatment again. And that's when the orthodontist referred for myofunctional therapy and actually asked, could I do it for free? And I was like, all right, this is someone who refers to me. Let me do him a favor. I'll do this evaluation. But it started making me think, wait a second, you refer for myofunctional therapy, but clearly you don't understand because you did not refer the patient before expansion, or you didn't understand that the palate was narrow to begin with because there was oral dysfunction. You're now trying to back up and do this after the fact when this patient was a mouth breather, all these other issues. So it was kind of confusing or interesting to me that this is a practitioner that does refer for myofunctional therapy, but really didn't understand that link between the underlying cause of the narrow palate was orofacial myofunctional dysfunction. And now we're going to try to go back and make up for this problem that wasn't addressed to begin with because the patient was upset. So it's interesting. So I think a lot of practitioners don't understand that underlying component. I'm wondering, in terms of sleep breathing issues, because that is one of your specialty areas, as a dentist, do you screen all patients for sleep disordered breathing? And what do you do for that screening? And how could other dentists start incorporating things like that who aren't aware?
Yes, I do screen all patients for sleep disorder breathing because I do sleep for living. And of course, I don't want my patients. I have a general practice, I have a hygienist, and my team is trained on that and how we screen. It's so obvious to the dentist. I mean, if dentist just gonna open the eyes, but patient have sleep disorder breathing. And this is just so beautiful, broken down teeth. Somebody break the tooth and you see the signs of grinding. You look at the uvula and it's like you don't see the backside of the throat. You look at the tonsils and they kissing each other and sometimes don't kiss each other, but they're big and visible. And lips, they have a very special shine when patient breathe through the mouth. And then nose located right here in front of you, and the sides of the nose, they look thick. The nasal ala, they look thick. So that's another sign. And then those beautiful clues, what screening for you, it's of course tori on a palate, and then two toris lingually, but also wonderful signs of acid reflux. We're talking about burned out gum and burned out teeth, and they can be burned out in any spot. It depends the sleeping position. It can be lingually or inside, it can be outside, and they look very specific, not like abstraction, not like a step in. They look more like a burn enamel to me. So you look at those signs, and of course, sign of the mouth breathing when the gum is so puffy in the front and bleeding with even with your look, or maybe look blue, and in the back it's not so bad. So obvious sign of a mouth breathing and all of that.
Yeah, it's really obvious.
A couple things I want to add, and I hope dentists or young dentists who listen to me, it's gonna make a conversation easier. I start doing microbiome testing. And I love algorithms. I love systems. So just like I talked to you just a minute ago about physical therapy, what function follow the form, so form and function so connected, and physical therapy needed for any therapy. And it's a medical concept. Same thing, everybody getting the blood work done. On a regular basis, nobody asks. But for the dentist, we don't have any type of test to explain to patient, okay, we look at the blood work, your hemoglobin is high, maybe, this and that, or you have inflammation because white blood cells are high, or maybe your vitamins are low. So doctor have so many things right on a paper to show to the patient, to explain what type of treatment they need. But for us, now we have a microbiome, and different bacteria, they show a certain, they indicate, and I have them written down here, and I can read them to you, but there are bacteria which show very low percentage of nitric oxide. There are some bacteria which show predisposition for sleep apnea. And yes, I do this microbiome testing for periodontal disease, but very often I find that this disease follow other disease. So we can start this conversation, and I can say, look at this. You see this? This is a predisposition for Alzheimer, and you have some other things. It's a good idea for you to have a sleep study done.
And that's a really clear way for a patient to actually see the information and to understand the data. So how do you do microbiome testing?
From saliva, I use Simply Perio. I actually met them Academy of Systemic Connection. We had a meeting last year, like exactly a year ago. And there are a lot of tests and DNA tests, but I work with this company. I find it very clear, not that many pathogens. They have a line of pathogens and it look colorful on the screen. But there are a lot of tests there are some immediate testing. I interviewed Dr. 𝘃𝐈𝐒𝐂𝐋𝐀, and he has a test right on the spot. It can show nitric oxide deficiency. So that can be a great way to explain the patients. So there are a lot of tests right now. And I interviewed Dr. Zuckerberg, father of Mark Zuckerberg. He also have a saliva test on a little bit different topic, actually, for people who concerned about oral cancer. So he has saliva testing on that. So it's a great way to address. So I use that test, and I do the conversation that way, trying to bring health to my dental patients from comprehensive perspective. It's not so common. Now my practice kind of understand that, especially I have a podcast and I wrote articles, so they listen to me with more attention. But I understand it's difficult for young dentists to break that wall. But just like we talk about the raindrops, like you did for Dr. Mew, those raindrops, they work.
That's so sweet. So for microbiome testing, is that something that a patient can only get through a provider like a dentist who has that accessibility, or is it something people can order on their own? And when you get the results, is it all described out to you, or do you have to do interpretation? So if a patient's able to get the testing on their own, do they get a report back and they know what the problems are?
This test does not provide interpretation. So every test I do, I usually present to the patient and I explain what it means. Maybe there are some testing what are for consumer. I assume what that test, what Dr. 𝘃𝐈𝐒𝐂𝐋𝐀, and it's not his test, but test associated with him. I think they have for consumers, and maybe they have an explanation, but I didn't look into that. So I wouldn't be able to answer that question. But not only dentists can order that test. Functional medicine doctors, a lot of them use that test, and they use the help of dentists to address the oral microbiome. So they can bring the red flag and do the explanation and then refer to dentist.
And we know a lot of patients with sleep disordered breathing issues have poor microbiome. So there's imbalances with the microbiome. And also, I know Dr. Ghazal has been talking about potentially screening or diagnosing sleep apnea, at least in children, through urine testing at one point. So that just goes to show that it's not just a structural issue, as we know, but there are markers in our body, our bacteria, our urine, systemic markers that could really help in the diagnosis of such problems. So really interesting time to be part of all of this. And
Yes.
yeah, I really thank you for all of the information that you've just presented to us, and excited about your book coming out soon. And we're all going to follow that because that just sounds really fun and interesting. And any last words you might have, or any hopes for the future of dentistry?
I have a lot of hopes. I express a lot of them in my book, or I express them through my podcast. I really would be very happy if your audience would follow my podcast. And of course, we're gonna broadcast the interview on my channel and on social media through the Instagram, Dr. Maria Sokolina. I would be very happy to learn about their stories and challenges. Or if they watch through the YouTube, it's the same. They can just Google Dr. Maria Sokolina. What I think gonna change, this is my personal view, and I think you're doing that already, what people, not the medical providers, but people who get educated, they're the best health advocates and concerned caregivers, they can change the system. That's what I believe. It's very hard when it comes from providers, but when it comes from people who are looking for help, they find logical, and they understand, and they know it's gonna give them the results they are looking for. They're concerned about airway, because now I see that when mom comes and they say, I'm concerned about breathing my child has. So the work you do, changing the landscape. So that's what I hope. It's going to be more people like that who educate themselves enough to be concerned about their family members or themselves. And I think that's going to change the system, and it's going to go to the dentist and to medical providers, and we're going to live in a healthier world, because I think we need to be a little bit less broken at this point.
Yeah, that's so beautiful. Almost like an airway riot. All the people are like, we're rioting for airway because the medical providers might be unaware of this, and we won't stand for anything less. Because yes, people are seeing these problems in themselves and wanting to prevent it in their children, or seeing these problems in their children who are already suffering and learning about this and saying, we need to make a change. And I'm not going to accept less. I think a benefit of social media, although there are many negatives, but a benefit is people are coming together and asking questions. A negative is when one parent answers a question but doesn't have all the information, then people can get misinformed. But that unity and that ability to reach out to people easily and get help and support, and reaching out to professionals. There's a lot of professionals in these Facebook groups that are taking their time to help answer questions. There's only so much you can take your time to respond to every post and things like that. But also these podcasts and social media is really helping people get this information. And I bet if we did a Chat GPT question, I bet Chat GPT probably knows a lot more than a lot of medical doctors about sleep and airway. So I think we're getting there. We are getting there. So thank you so much, Dr.
Thank you
for your time. That was really wonderful. I really appreciate it. Take
Thank
care.
you.
Thank you. Thank you so much for joining this episode of Airway Answers. I'm hoping some of your airway questions were answered. Please feel free to give us a rating or a comment. And if you have any further questions, you're welcome to email me at nicole@airwayanswers.info, or check out our site at www.airwayanswers.info. Thank you so much, and join us for the next one.